Hello guys, my name is Livia Pramesti. Here we would like to learn about intracranial bleeding. Well, there are 4 types of intracranial bleeding. First is hemorrhagic stroke, and then subarachnoid hemorrhage, subdural hematoma, and epidural hematoma. Subarachnoid hemorrhage. What is subarachnoid hemorrhage? Subarachnoid hemorrhage is bleeding between space arachnoid and diameter. Here is arachnoid, here is in diameter, which is the blood is located here. What is the etiology? The etiology is rupture of berry aneurysm. Why it can be ruptured? Because the vessel wall is weak, and then there is abnormal dilation as well. The onset of subarachnoid hemorrhage is suddenly, and then the most common symptom, sometimes the patient complain about it's the worst headache in their life. The other clinical feature is fever, nuchal rigidity, vocal deficits, and then loss of consciousness. Why it can be loss of consciousness? It's because sudden increase intracranial pressure. Here is the signs of blood in subarachnoid hemorrhage. Subarachnoid hemorrhage. How to diagnose subarachnoid hemorrhage? To diagnose is we use non-contrast head CT scan. When is the highest sensitivity to diagnose? Within the first 1 to 6 hours of onset. Beside the non-contrast CT scan, if the result is negative and we still suspect that the patient has subarachnoid hemorrhage, we can use lumbar puncture. What is the result? The result is xanthochromia. How xanthochromia look like? It looks like yellow, like in this picture. Why is it yellow? Because the breakdown of the red blood cell. One of the cause of subarachnoid hemorrhage is berry aneurysm. What is the most common symptom of berry aneurysm? The most common symptom is asymptomatic. We said that if it's symptomatic, it can cause subarachnoid hemorrhage. Berry aneurysm is rarely enlarged to cause neurologic impairment. Berry aneurysm occur in circle of Willis. Most common location is anterior communicating artery. Here is the location of anterior communicating artery. And then beside it, there is posterior communicating artery, and then middle cerebral artery. Here are association of berry aneurysm. First, polycystic kidney disease, Ehlers-Danlos syndrome, Marfan syndrome, hypertension, and smoking. Anterior communicating artery aneurysm. What is the sign and symptom of anterior communicating artery aneurysm? They are headache and visual field defect. Visual field defect is bitemporal hemianopsia. Why? Because it compresses the optic chiasm. And then beside our anterior communicating artery aneurysm, the disease that causes bitemporal hemianopsia is also primary tumor. Posterior communicating artery aneurysm. Posterior communicating artery aneurysm cause headache and eye pain. It can also cause cranial nerve 3 palsy. Yeah, for eye, it can down and out. It can also cause ptosis, pupil dilation, which is non-reactive to light. Pupil sparing. How if pupil not dilated and if pupil same, it means that it is not caused by aneurysm. It is caused by other etiology. They are ischemic neuropathy cranial nerve 3, diabetes dan juga diabetes and painful, which is the pupil is spared is spontaneously resolved. Here are the treatment of subarachnoid hemorrhage. First of all, we can treat with endovascular coiling or clipping. And one of the most common complication is rebleeding and vasospasm. Vasospasm triggered by blood, which is cause worsening symptom. Vasospasm start days after initial bleed. How to prevent vasospasm? To prevent vasospasm, we use nimodipine or calcium channel blocker. That is, it can improve outcome and prevent vasospasm. Subdural hematoma. Subdural hematoma, bleeding between dura mater and arachnoid. Dura mater and arachnoid. What is the etiology? The etiology is because trauma, which is rupture bridging vein. Subdural hematoma is slow bleeding due to low venous pressure. The risk factor of subdural hematoma is old age, alcohol, and blood thinners. Old age, it can cause brain atrophy or automatically increase bridging vein space and then lead to rupture. Other example is shaken baby syndrome. Subdural hematoma rarely occur acute. When it comes to acute, the sign and symptom is severe neurologic impairment and coma. But it can also present as chronic, which is slowly over days and weeks. Chronic subdural hematoma. The symptom is headache, neurologic impairment, and somnolence. Meanwhile, the acute is severe neurologic impairment and coma. Diagnosis of subdural hematoma is CT scan, show crescent-shaped appearance, like moon-shaped appearance. Subdural hematoma. How is the treatment? The treatment is surgery versus observation, depend on size and symptom. What is the indication of surgery? Hematoma more than equal to 10 mm and midline shape more than equal to 5 mm. Epidural hematoma. Bleeding between skull and dura mater. Here is because traumatic fracture from temporal bone. The etiology is because rupture of middle meningeal artery. How to diagnose? Use non-contrast CT scan. The shape is convex shape like this. Treatment is urgent surgery. How is the symptom of epidural hematoma? Which is because of increase of intracranial pressure. It can lead to headache, drowsiness, and loss of consciousness. It also causes lucid interval, which is loss of consciousness due to initial brain trauma, and then patient can be recovery, and then loss of consciousness again due to accumulation of blood. Well, it's all the intracranial hemorrhage. Thank you for studying with me. Good luck for everybody who have same exam with me.